Let's now move our focus to this story where the South African Medical Research Council wastewater surveillance team says it has recorded a decline in concentrations of COVID-19 fragments in most wastewater treatment plants. The team takes weekly samples of wastewater for analysis from 72 wastewater treatment plants in urban and rural areas across 4 provinces. This is to support the management of COVID-19 in the country. And joining me now is Professor Angela Mathee from the South African Medical Research Council to give us more details about this. Professor, good morning. Let us start off then with why was it important for the team to track the fragments of COVID-19 in wastewater?
Well, there's several reasons why it's very, very helpful to track SARS-CoV-2 RNA in wastewater. The first is that you can usually pick it up a week or two in advance of when you see a rise in community COVID cases. And the second is that it's relatively cost-effective to do, because with a single test at a wastewater treatment plant, you can get an idea of what's happening in relation to COVID-19 in an entire wastewater catchment area. So that means with a single test, you can either test for 10,000 or several 100,000 people. And the third reason is that you get an idea of what's happening for people who are both symptomatic and asymptomatic. So it's a really cost-effective and useful a tool to have in our arsenal of measures against or for the management of COVID-19.
So then what does the decline tell us? Does it mean that the prevalence of the virus has gone down or less people are washing their hands?
What it indicates is that there may be a lower number of people with active COVID-19. So it's an encouraging sign. It gives us hope that cases may be coming down. But as we know, anything can happen with COVID-19. And especially now with the festive season, we must remember that it's not a time to let down our guard. If it's coming down, we want to keep it on that downward trend. And so it becomes very, very important for everyone to maintain their vigilance with wearing masks, with hand hygiene, with avoiding crowds and gatherings. And if they're essential gatherings, then to keep them outdoors or in well-ventilated spaces. And we keep on urging people also to become vaccinated and for those who are eligible, to have their booster shots.
Why is it necessary then for us to track what is in our wastewater?
Well, because the genetic material of the virus is shed in feces, and so we can pick it up in wastewater or in sewage systems. And that gives us this very useful indicator of what's going on in our communities in relation to COVID-19. There are also other uses that we're investigating now. We can also track what a community is facing in terms of chronic diseases, HIV, for example, diabetes, hypertension, etc. So beyond COVID-19, there's a lot of hope that we can use this platform as a very valuable, broad-based public health facility beyond COVID-19.
Now, were the cities that you monitored selected because of the prevalence of COVID-19 cases, or what really informed this particular investigation?
There was a lot. There were many factors that we considered. At the start of the COVID-19 pandemic, it was just various teams at the South African Medical Research Council coming together to say, how can we help? What can we do to help manage COVID-19, save lives, and prevent disease in our country? And then in terms of rolling out the program, it was where with the university partners, the laboratory partners, that could be involved in the program. And so we ended up with working with Fort Hare University, Nelson Mandela University in the Eastern Cape, and in Limpopo Province, the University of Venda, and in Gauteng, Sefako Mahato University. And then, of course, we have the South African Medical Research Council's Bioinformation, a medical research platform. And that helped us decide on the provinces. So the provinces are the Eastern Cape, Limpopo, Gauteng, and the Western Cape. And then there were also training needs, equipment issues, sampling networks, etc. So a range of factors that led to us having the program that we have now, and we hope shortly to expand to northern KwaZulu-Natal and to the Free State as well.
Now, Prof, you've mentioned various provinces, including, of course, Limpopo and Gauteng. What was the differences that you possibly could have found within the provinces and in the investigations with these different provinces?
So the interesting thing has been the difference between the more rural areas and in the urban areas. I mean, in this fourth wave, we started seeing rises in the concentrations of SARS-CoV-2 RNA in urban areas about 3 weeks before we started noticing an increase in our rural sites. But right now, what is taking us by surprise as this virus continues to do is that we're seeing a drop in the concentrations of SARS-CoV-2 RNA in rural areas as much as in urban areas. So for this week, we've noticed that there's been a decline or a leveling off in the concentrations of SARS-CoV-2 in 89% of our urban areas as well as in 97% of our rural areas. So that gives us hope that we might be on a downward trend. But as I said before, it's really not time to let our guard down at all, especially in the light of the upcoming festive season, because things may change. We might be seeing a downward trend for a few weeks and then things may start rising or the concentrations may start increasing again. So we're definitely urging people, we're saying this is hope of good news, but we're urging people to be very, very careful and to continue being vigilant with all these non-pharmaceutical interventions.
And so, Prof, how should ordinary people factor your report into their daily hygiene practices in the fight against COVID-19?
We are urging people to just continue. These simple measures, the non-pharmaceutical interventions like wearing a mask and avoiding crowds and being very strict with hand hygiene, and if you have an essential gathering, to keep them outdoors or in a well-ventilated space. Those are such simple measures, but as the World Health Organization has repeatedly said, they have been shown to be very, very effective. So for ordinary people like you and me, I would say if we just stick to those measures, make sure that your mask fits properly, that you wear it over your nose and your mouth and not under your chin, that you continue with those simple measures because they are simple, but they are very, very effective. And then the hand hygiene, avoiding crowds, avoiding gatherings, and keeping them outdoors or in well-ventilated spaces whenever possible.
Now, we do know that the health department has revised their protocols, Prof, on contact tracing. What's your view on this in the work that you do?
Well, I mean, I assume that all of that information is evidence-based, and I recognize also that there is always a balance that we strive to achieve in terms of keeping people safe and preventing disease, preventing death on the one hand, and then protecting our economy on the other hand. And I know we have excellent scientists making these decisions and informing what the health department does or the recommendations that they issue. So I would support any scientific and evidence-based decisions that are made.
That is Professor Angela Mathee from the South African Medical Research Council. Thank you so much for your time this morning, Prof, and for the work that you're doing for the country.